Hi,
How are you doing today?
I'm good. How are you?
I'm okay. I had a lot of work and I ended up sleeping, so maybe mental health day, I don't know. Slept for 4
Everyone
hours.
should tell you.
That was, yeah, I don't know. So, I'm just gonna introduce you to all our viewers who haven't been acquainted with your work. So, Harshita is a mental health advocate who is passionately working towards educating herself and everybody else about human rights, mental health, and feminism through her social media presence. She has a degree in literature and a diploma in arts based therapy, and she wants to make a difference with the way people view and perceive mental health. As the founder of The Turning Point, it is an initiative taken for everyone for mental health. She aims to reduce the stigma which is attached to the topic and create a safe space for everyone. So, thank you so much for coming here today, Harshita. I don't know if you know, but Sakshi's campaign right now is working towards making each home a safe space during the
Yeah.
lockdown. So, I'm really excited for our conversation today. So, let's just begin with how you are feeling today. How was your day today?
Um, my day was really good. I was unwell in the morning, so but it's okay. Like, it was fine. But
Are
I
you
took a
feeling better
complete
now?
day off for 2 days,
Mhm.
which is important. I think we all need to take day
Okay.
offs. We don't need to do anything.
That's very true, especially right now during the pandemic. So, I was told that your journey in mental health started about 4 years ago with an internship. So, how was that for you? How was your journey since then? And tell us a little bit about the internship.
So I was still in my second year of college when I was doing the internship. It was just a way of finding out what I'm really interested in. Is this a topic that I'm interested in? And I fell in love with it. It was like, why didn't I know all of this as a child? Like, why didn't anybody tell me this? I would have saved myself so much trauma. I would have dealt with things in such a better way. And I think that's where everything started, where I was like, this is where I want to be. Like, this is the space that I want to be in. And over the years, I tried, exploring different parts of this field. And I realized that I don't want to be a therapist. Like, in this space, everyone thinks like, you can only be a therapist, like if you want to be in the mental health space, which is true. There's not a lot of space for anybody else. So that was sort of tough, but still, I feel like more than becoming a therapist, I enjoyed creating content. I enjoyed, creating something that breaks barriers that, lie between why people don't seek help. And, sharing my personal story, there were so many people who reached out to me saying, even I want to seek help. Like, it felt relatable to them that, even I go through this anxiety, before going to a session. I'm like, because we all think like we can deal with it by ourselves. But
That's very
I
true.
think about my journey also made a lot of difference, which is what I like about this. I'm like, this is what I want to do.
So, just for, I think we had a question in the comment section, and everybody who's just joining us now and hasn't seen the creative, we will be talking about mental health, its advocacy, and Harshita's journey from where her internship to being a mental health advocate today. And just a trigger warning, we will be talking about mental health. There might be slightly sensitive topics, so just please take care of yourselves because that's what we aim to do here. So, Harshita, that was a really nice journey. You can see the growth you've made, and I think that's beautiful. So, I'm going to ask you a question we really ask, liking everybody who comes for our Sakshi Lives today. So, what are 3 words you would use to describe yourself today?
Um, I think emotional, a mess. Like, I think we all are a big mess. So just owning up to that, and determined. I think it. I think these are three words that I would use to describe myself.
That's beautiful, and I think a lot of us resonate with it today. The team at Sakshi has a lot of young individuals, and all of us are really tired, emotional, but we're also very determined. And we try to work hard every day, so we know how it goes there. So, talking about your initiative, The Turning Point, how did you get the idea to start it, and how is it going for you now?
So it's very interesting how it started. I was still doing my internship, and I had a lot of awareness about what mental health is, what mental health illnesses are, and it's you should seek help and all of that. I understood all of that, but it still took me some time to go to therapy. Like I was also still under the impression that I can figure it out on my own. But it still took me a lot of time to go to therapy. And even when I was going to therapy, when anyone would ask me where I'm going when I was going for my sessions, I say I'm going out. I'm like someone like me who has so much awareness. Even I am feeling ashamed to say that I'm going to therapy. And I realized that the stigma is so deep rooted. And that's where I'm like, I want to do something to create a difference in this space. Like people should okay with saying that I'm going to therapy. It's fine. Like just like I'm going to a therapist. Big deal. So that's where it started.
I think we are
And
progressing.
since then I decided that that's what I wanted to do.
So I think personally that we are making some sort of progress. We are much better than what we used to be. But I mean, it also gets to me personally. I start talking about mental health in spheres which haven't opened up as much. And then I go back home and I think, did I just scar somebody? Was it inappropriate? Did I make people uncomfortable? And that shouldn't be a thought I am processing. So, I think because of people like you and because of people who are coming out and talking about it, it is getting a little better. At least mental health is now known in each household. How deep rooted the awareness is, we are not sure about. But it's still doing much better than it was.
Definitely.
So,
and I think even COVID has had a huge role to play in the way mental health is perceived. It's not as stigmatized as it used to be because of COVID also, because everyone was isolated. They were forced to face their thoughts. And everyone was so frustrated, feeling so lonely that they were like, okay, now I need to seek help.
that's very true.
Like
So,
it's sad that it took a pandemic. Sorry.
That's all right. Please continue.
Like it's sad that it had to take a pandemic for this to happen, but now I'm glad that the narrative is changing.
We're just looking at the bright side here, if there is a bright side here. So, yeah, that's very true. I mean, the lockdown has opened up a lot of conversations because of initiatives which come up. People do have more time. So I agree that's a good thing. But that brings me to the question when it comes to social media for the dissemination of information, because that is where most people consume their content, consume their information. So a lot of it is not verified, and that's something every one of us has been struggling with, incorrect information. So what do you think? What are your thoughts on social media when it comes to providing accurate information? Because I look at a lot of content, a lot of it is created by people who aren't really experts in their field. So then they label things. I mean, just to trigger warning, but they talk about depression and then label symptoms according to what they think they are. But mental health cannot be boxed. So because of that, there's a lot of wrong information, a lot of people self-diagnose. So what do you think? You work in the social media sphere. So what are your thoughts about that?
So social media, honestly, firstly, is a very crowded space. Like, you need to make sure that you're following the right people, because you can follow 100 people and they can tell you 100 different things, and you will just get confused. So it's very important to follow the right people. And one thing that's very important to make sure when you're following anybody who talks about mental health is that if they don't have qualifications, they cannot provide services. If they are, it's extremely unethical. Or, even the kind of information that they provide, if you feel like, if it's not verified by a professional, or if they don't have any background in anything mental health, then I think it should be avoided.
That's very true. So viewers, please take away something from that. Make sure your information comes from a verified source. Most people who are experts in their field put out their qualifications in their bio, put it out multiple times. So please go to the right sources when you are getting information and try to stay away from self-diagnosing. Resources are available. I understand they are limited for a few of us, but please just make sure your information comes from the right places. So
Right.
I was
Exactly.
told
That's
that
very important.
very true. So I was told that you identify as a proud feminist. So has that had an impact on your journey as a mental health advocate as well in the public sphere as well as at home?
So I like to say that I'm a feminist in the making. because there's still a lot for me to learn in this space. I don't really provide a lot of information in that sphere because there's a lot for me also to learn. So before I can start educating people, I need to know that I have my information in place. I need to know that I am educated enough or I have read enough about it that I can tell people about it. I don't want to spread misinformed information, but it does have, like, it has had a huge impact on my journey because as I moved, it started with mental health. That was the only topic that I was interested in. But with social media, I mean, as there are a lot of unverified sources and all, but there are a lot of people who are creating a lot of good content. And after looking at their content, there are so many things that I learned about myself, about topics that I was interested in. Like feminism was one topic that I realized on social media after seeing a lot of people's content, that this is something that I resonate with a lot. So after that, once you start resonating with something and once you start educating yourself about at least social topics, your perspective is different to look at things. Like, even for that matter, feminism and mental health, like, it changed a lot of views. Like, mental health is not personal anymore. Like, that made me realize that mental health is not personal. Like, it is political. Social issues or psychological issues do have an impact on mental health.
You are a huge advocate for mental health and therapy. We have established that, but you said it comes with a lot of stigma. So, do you have intel or do you have opinions about why the stigma exists and why people still hesitate before approaching a professional? And that being said, do you think social media advocacy has a role to play, and how huge of a role to play when it comes to changing all of this?
Definitely, I think social media, as many, you know, cons as it has, it also has a lot of pros. Like, people see this information on social media and they reach out saying, whenever I post something about therapy, they'll post like there are so many people who have individually reached out to me saying, asking questions about therapy. That, what is it like? Who can I go to? So, it's great that people reach out, see this information on social media, and then reach out to you saying that I want to go to therapy. It's a very fulfilling feeling.
So, when it comes to therapy, what in India there is not many resources which are available, at least in the public sphere. So, what would you recommend an individual looks for when they go to a therapist, and some spheres they could be looking at?
So, when you go to a therapist, so you have to connect to the therapist. Like, you have to feel safe with the therapist. So, generally, before going for a first session, you can always call the therapist and ask for a 15-minute introductory call to, get to know them, get to know their processes better. You can ask them what their qualifications are, what their, expertise lies in, or what is their experience in dealing with the kind of issues that you are coming with. Like, all of these questions are very normal to ask a therapist, and they will very willingly answer these questions. And if you feel like, okay, I connected this person, you can try and take a first therapist. You will first session, like, and when you take a first session, when you talk about your feelings, you will know whether you connect, whether you will be able to, open up to them. Are they empathetic enough? All of the qualities that you want, you'll get to know in the first session. If you connect, great. If you don't connect, you can try it with another therapist. Like, this is something that I really want to stress on, because a lot of people go in like, for a session with a therapist, and if it doesn't work out, they think like therapy doesn't work for me. It's not like that. Like, they're probably that therapist and you, like, y'all didn't connect. The therapist was not right for you. That doesn't mean the therapy itself doesn't work for you. Like, you can always go and see another therapist. Like, it's the same. Like, whenever anybody asks me any question about a therapist, I say that, if you go to a doctor, there are some doctors whose ways or processes you don't like. There are some doctors who will straight away give you medicines, and there are some doctors who will tell you try this home remedy. Everybody has different processes. Some you may connect to, some you may not connect to. It's the same with therapists. Like you may not connect it to.
That is something a lot of us do not know. So thank you so much for sharing that, and I hope it's helpful to somebody who is looking to get into professional health. And I hope that is successful for whoever there is. So I was also told that you do a fun segment on Instagram where you review your favorite books. So how has that been to you, and what was the favorite book you read this year?
Okay, so I got into reading pretty recently. I like 2 years back, I used to say that I hate reading. Like I couldn't read beyond 50 pages of a book. And now I'm just in love with reading. Like I need to have a book to read at all times. And I think there was one book that really changed it for me, that really got me interested in reading. And that was a book called Maybe You Should Talk to Someone. It was a book about a therapist, her clients, and how she goes to a therapist going to therapy, and her clients. So it was really also involved in the book, which is why I loved it. It's not like mental health has to be a very serious topic that you only talk about very seriously. There can be humor, that is, appropriate humor should be there. Like it's something as normal as your health. So it's okay to make a few jokes about it. It's okay for therapists to go to therapists. They're humans after all. Like they also have emotions and you can't expect them to process everything on their own. Um, like just like a doctor cannot perform their own cancer like surgery, a therapist cannot solve their own problems sometimes. So it's okay to go to a therapist. And just it was a beautiful book. And if anybody wants to read, that is a book to go. Like you should read that book.
Could you just repeat the name of the book and its author for our viewers?
Maybe you should talk to someone.
Alright, do you
And maybe
remember?
we should
That is very true. At Sakshi, we talk about building compassionate communities and collective action, where all of us want to rise together and overcome whatever tiny, huge problems we have in solidarity with each other. So, we do encourage conversations about mental health, about abuse, everything that actually I believe genuinely matters in today's world. So, just I think we have time for one last question, if that is okay with you.
yeah.
So, when we talk about mental health, there is obviously a lot of stigma which comes with it. I think we've established that enough. So, at Sakshi, we want to flip the script on the ideology of destigmatizing it. So, what is something you believe you are grateful for and for other people as well when it comes to the whole mental health journey that you have been through?
I think one thing this is something that I express my gratitude to every single day is my privileges. A lot of at times we take a lot of our privileges for granted. And the minute we start acknowledging and being grateful for our privileges, a lot of times we find ourselves cribbing for something that a lot of people don't have access to, don't have the privilege to. The minute we start being grateful to our privileges, that I have the privilege to access therapy, which is so expensive. I have the privilege to, education. I have the privilege of a family. Like a lot of people don't have that. Just acknowledging your privilege, just being grateful for it is very important. And with mental health, I think one thing that we all need to remember is don't, how do I say it? Think of your problems as something small. A lot of people have it worse. That's not what I mean when I say privileges. Your problems are equally as important. You should not say that, a lot of people have it worse, so I shouldn't think about it. That's not how it works. Your problems are as important as anybody else's, and you require the equal amount of support. So that's something that is a lot of us need to remember. And it's okay to ask for support if you need it.
That is very true. So thank you so much for sharing that with us. I think there's a lot of, people, at least in my personal experience, people don't want to bother other people, but they don't understand that your loved ones actually want to help you. And I get where they're coming from over there, but that is something we are trying to establish through having more conversations. And that's one of the major reasons we are doing these lives, so that people start being oriented with the right idea when it comes to mental health support and collective action. So I'd just like to take a couple of minutes to introduce Sakshi, unless you have some last few words you want to share with the viewers.
Yeah, because of what you said, I remember something that I had seen on a therapist's story, and I had added that to my daily reminder list. She had mentioned something about, reminding herself every day that I'm not an inconvenience. Like a lot of us feel like we're bothering people with our problems. So I constantly remind myself every single day that I'm not an inconvenience.
That is a very different, and I like that approach. I think I should start including it in as well. And viewers, if it works for you, daily reminders work for you, I think you should give it a try, because it's been vetted, tried, and tested. So, if there isn't anything else, then I'd like to take 2 minutes to introduce Sakshi to all the viewers who don't know who we are, if that's okay. So, for everybody,
Yeah.
Sakshi has been working over the last 3 decades and has been focusing on strengthening systemic mechanisms and enabling preventive intervention for the practice of everyday equality. So, we also have a pilot project, that is the Rakshan project, through which we are aiming to equip the NSS volunteers across the country. So, these are 18 to 22-year-olds, just like most of our viewers here right now, and we are trying to equip them with the capacity to prevent, prohibit, and intervene in cases of sexual offenses when it comes to children. So our aim here while building our action is to build a preventer of harm. And at Sakshi we have this saying where we say ना करेंगे ना करने देंगे, हो रहा है तो रोक के रहेंगे, and अगर हुआ है तो बोल के रहेंगे. So that's about it. That's about us. And thank you so much for coming in. I'm in
Thank
awe
you
of the
so
work
much
of the
for having
organization.
me.
This was an extremely interesting conversation with Harshita today, dear viewers, and we spoke about her journey. We spoke about the politicization of mental health and how we could work towards destigmatizing therapy. So thank you so much, everybody, for joining, and thank you so much, Harshita, for talking to us today.
Thank you so much for having me.